Hear that ticking? People's frustrations, building with being kept in the dark. Because when it comes to the coronavirus, COVID-19, the government is sharing only part of the truth and vital information seems to be withheld. To explain that, I will explain what seem to be the three options. Firstly, ending isolation with a sudden mass release and why that is not on. Secondly, waiting for a release until a vaccine is developed and why that could hurt. Thirdly, isolating the sick and the vulnerable and releasing the healthy as proven successful overseas. And an added point on treatment for those with coronavirus. While I empathise with the government's very difficult challenge, people need answers. There's no manual on how to do this. Yet people are feeling confused, afraid, concerned. Some feel lost, grieving for those dying and grieving for our country. Some feel angry. Many are still living in disbelief and plagued with uncertainty and fear over how to pay their bills. People want to know what has to be done, why it has to be done, how long before it's over, and what will be the cost: financial, social, personal, mental, emotional. It is the people who have to repay these huge bills of up to around $300 billion to which the government has committed Australian taxpayers. People have a right to know the facts. Yet the Prime Minister's first discussion of modelling on the 7th of April lacked specifics on the expected duration of isolation, lacked a plan, lacked triggers for releasing people. Simply repeating the words 6-month hibernation is not enough and kills people's hope and raises their concerns. A solid plan is fundamental for trust and hope. People expect governments to lead and expect leaders to have a plan based on solid data and facts, and to share that plan and the information behind the plan. We need to acknowledge successes. The government and Australians generally can claim success in avoiding the overwhelming of healthcare services and avoiding a high death count. Sadly, 63 people have died, yet that is way better than many nations. In my speech in the first special one-day parliamentary session on Monday the 23rd of March, I stressed the need to take hard, strong and quick action because many politicians are afraid of being seen to be making mistakes or being wrong. What would have happened if it had just been mild? 2 days later, I repeated that call in my letter to the Prime Minister. See the link below. A little over 2 weeks later, in the second special one-day parliamentary session on Wednesday the 8th of April, and in my letter to the Prime Minister yesterday, I discussed the need for a plan for recovery and for sharing that plan with the people. The links to that speech and to my letter are below. Now, there are two health and safety aspects: individual health, protecting people's lives, and preventing an overwhelming of the healthcare services. After a lot of public pressure, the Prime Minister was pushed into a media conference on Tuesday the 7th of April to discuss the government's modelling of the virus's potential impact. Disappointingly, he was light on details and facts and big on words. He did not release the modelling, did not discuss the key assumptions of infection, transmission and fatality rates, did not discuss the variables modelled, discussed no results from the modelling. How then could people make meaningful conclusions? We couldn't. The Prime Minister did not discuss various alternative strategies for a national plan. Our staff found the New Zealand modelling report, and it's worth noting the Kiwis thanked Aussies for helping them build their model. Yet the Kiwis released their report many days before the Prime Minister's media conference. And the UK's Imperial College of London model has been released for some time. Both show that unrestrained release of people from isolation would lead to an epidemic unless successful treatments or vaccines are released. A key point is that the virus still exists in the community, and releasing restrictions without monitoring would be disastrous, because when we're let out, the virus will still be waiting for us. Now, the graph you see is from the Kiwi modelling report. The left-hand side with blue background shows isolation, the period of isolation. And the government strategy of lockdowns could be seen as the green line, the number of infections that hugs the baseline until isolation ends. Then, in the white background, that's the period where isolation ends. And the epidemic breaks out because the virus is still among us. Now, I'm no expert and want you to make sure that you know that I don't think I purport to be. I'm not an expert. I simply accessed information and listened to people, including our staff who've done our basic research, and I conveyed the basic ideas and options to you. The first option of quick mass release of people from isolation would mean an epidemic, many more people dying and possibly our health system being overwhelmed. We can't do that. That means we either need treatment or a vaccine, or somehow build people's immunity across the entire nation. A second option is to keep people in isolation, lockdown, until a vaccine is developed. We can't do that for two reasons. Firstly, the emotional and mental health toll would be too high. And secondly, our economy would be slaughtered. There's a third option, and that is to adopt something like an Australian version of the highly successful strategy used in East Asian nations, especially Taiwan and latter South Korea. That involves isolating the sick and those who have the virus, and isolating the vulnerable, the aged and those with compromised immune systems, adding massive screening of healthy people for elevated body temperature, and then testing those with high temperatures and with other symptoms of the virus. Then those with the virus are sent to isolation. Those without the virus go back to work or keep working. The point is that Taiwan has a population of 24 million people, almost the same as Australia, yet has recorded just 6 fatalities, despite heavy contact with the virus before Australia because it is near to China, and their economy had hardly missed a beat. So far, the Prime Minister and his medical advisors spend their time telling us what has happened when we need to know what is going to happen next. The Prime Minister has not shown us two things: the whole plan, including what happens next, and how long this will continue. The second half of the model seems to be missing. We, the people, deserve to know and want to know the whole story. On what basis is the Prime Minister spending $300 billion of our taxpayer money? The Prime Minister needs to tell us his government's plan and the triggers for strategy changes. This builds understanding, trust and hope. The government does not trust the people, and eventually the people will not trust the government. The government has put Parliament and therefore democracy in hibernation. So in my second letter to the Prime Minister, I asked 3 sets of questions on the modelling, the data and the plan. The links to my letters and videos of speeches in the Senate are below. Some medical specialists are asking, does COVID-19 attack our vascular, our blood circulation and oxygen absorption system, or our respiratory system? We need to know, honestly. The chances of developing a vaccine against a virus that attacks our respiratory or blood system, determines our fate. People have dreamt of vaccines for the common cold, a type of virus, for a century or more, yet there is still none. SARS is a coronavirus, and after 17 years intense research and billions of dollars, there's still no vaccine. Experts say chances of a COVID-19 vaccine are very low. What about treatment? Treating people with a cure? What are the government's plans to consider using ivermectin to treat people who have the virus? It's been 100% successful in laboratory tests at Monash University. Are there any plans to treat people with a proven drug, like the malaria drugs, including hydroxychloroquine, that reportedly is having wonderful results in New York? In summary, Australians want to know, how long will I be working from home or not working and stuck at home? When can we get back to work and school? When will we be safe from this virus? Politicians won't solve the COVID-19 problem. Research and science will. Until a vaccine is found, and despite all that we are doing, COVID-19 is still out there waiting for us. From what I've seen of Australians behaving as we have in recent weeks, and it's marvellous, and from what I've learned from successful strategies overseas, there is a reason for optimism and real hope. We must, though, continue to be disciplined, and the government must base policies, strategies and plans on solid data, on empirical evidence, and share that data accurately and fully and honestly with the people. When this is over, everyday Australians of all backgrounds expect to see and deserve to be a healthy, secure people with a proud, independent Australia once more that reflects our lifestyle, culture, values, freedoms, democracy and potential. All people want is a fair go and governance that we can trust to serve us and work for our country. If you're concerned about this issue, please contact your local Member of Parliament and get your friends and relatives to contact your local member and demand to get a fair dinkum explanation, because we all deserve to know. I've spoken on your behalf in the Senate and have written to the Prime Minister twice and will continue to hold the government accountable on your behalf.